So now we're going to talk about hyperthermia and its causes. One of the causes is fever, then we have heat stroke, then we have drug-induced hyperthermia, and that includes malignant hyperthermia and neuroleptic malignant syndrome. Fever, anytime you have gram-negative endotoxin lipopolysaccharide, LPS, that stimulates monocytes macrophages, and these macrophages secrete cytokine, especially IL-1, IL-6, and TNF alpha, IFN alpha, and these are called pyrogens. So the IL-1 induces prostaglandin E2, induces the generation of prostaglandin E2, and that also causes pain in peripheral tissues that is associated with fever, arthralgia, myalgia, and so these pyrogens, along with prostaglandin E2, is sensed by circumventricular vascular organ around hypothalamus. Circumventricular vascular organ that is called organum vasculosum of lamina terminalis, OVLT. This is basically a network of capillaries surrounding hypothalamic regulatory centers. So PGE in E2 in OVLT stimulates PGE receptors on preoptic area of anterior hypothalamus. Specifically EP3 are the receptors that you want to remember, and that they stimulate the production of cyclic AMP from glial cells to release monoamine neurotransmitters, and the whole mechanism basically stimulates the raise in hypothalamic set point, and this is how fever is produced. Now we're going to talk about the mechanism of chills. How do chills occur while with fever? So anytime you have a raised hypothalamic set point, and we already talked about how does the raise occur due to fever, then blood temperature takes time to raise the temperature of its own. And so basically anytime you have fever, so the core body temperature is raised, but the blood temperature is not raised yet, and it's slowly rising. It's low early on. So to raise the temperature of the blood along with the core temperature, body activates heat producing mechanisms, which are vasoconstriction, piloerection, epinephrine secretion, and shivering. And these are the mechanisms by which body can produce heat, and we have already talked about in detail how do these mechanisms occur. And then so increase in blood temperature can also help fight bacteria and viruses by since their enzymes may not be working properly at a higher temperature, and that's how body fights off bacteria and viruses. So once pyrogen is removed, your set point returns to normal, and this causes vasodilation and produces flushing reaction, and sweating also occurs to lower the temperature of the blood. So this vasodilation and sweating together basically are the good prognosis. Back in the days, doctors could actually sense that the patient is getting better just by these two phenomena of vasodilation and sweating. So let's talk about heat stroke. Anytime you have body temperature reaching up to 40 to 44 degrees centigrade, you have initially vasodilation occurring in the skin and sweating to lose body heat, and but as the temperature increases, you have impairment of cooling mechanisms such as sweating and vasodilation, and that continuous increase or rise in temperature is very damaging to organs. Organs can get denatured, enzymes don't function, and then you end up with multi-organ failure. So sweating causes loss of fluids, and that decreases ECF volume, and ultimately your central venous pressure is decreased, and blood, if you're standing, blood pools in limbs, And let's suppose you happen to be working outside, all of a sudden a heat stroke, you're standing, you're working or something, and that decrease in ECF volume due to loss of fluids causes the blood decrease in blood flow to the brain, and cerebral blood flow decreases, and that causes syncope. Skin vasodilation also decreases arterial pressure. Your blood pressure drops. That also decreases cerebral perfusion, and this leads to the symptoms of confusion, loss of consciousness as well. Extreme heat also, as I mentioned, denatures proteins, affects the heart. You have decreased contractility in the heart muscles. That decreases cardiac output and stroke volume, and that also decreases the cerebral and coronary perfusion, and also decreases renal perfusion as well, and which shuts down the kidneys due to ischemia, and that's how you basically are having multi-organ failure. Heat injury stimulates cytokines IL-6, IL-1, TNF, alpha, and this stimulates tissue factor and tissue thromboplastin on endothelial cells. So normally endothelial cells do not produce tissue factor. However, in case of an injury, that basically stimulates tissue factor. And then if you can recall, tissue factor is stimulates the extrinsic pathway of coagulation cascade. And basically anytime you have tissue factor stimulated, this is basically going to cause body to become more into a hypercoagulable state. So tissue factor binds factor 7 to activate factor 7a, and tissue factor along with factor 7a activates factors 9 and 10, and factor 10 basically converts prothrombin to thrombin, and you have large increase in thrombin formation. Thrombin activates fibrinogen into fibrin, and fibrin clots then deposit in microvessels. You have once you have fibrinogen converted to fibrin, you have aggregation of fibrin monomers, and these form clots, and those clots deposit in microvessels, which basically cause the blockage of blood flow and causes ischemia to the organs, and this is another way you have organ failure. And then consumption of platelets and clotting factors due to increased clot formation, as we talked about, that ultimately reduces the amount of clotting factors available for the body to clot. So this decrease in clotting factors cause hemorrhage, and then simultaneous clot formation and bleeding basically stimulates the phenomena of DIC, disseminated intravascular coagulation, and we'll talk about in detail about this in a next video about DIC. Another manifestation of extreme heat is it breaks down cell membranes of skeletal and cardiac muscle, and that causes rhabdomyolysis and myocardial necrosis, and this releases myoglobin, and myoglobin further damages poorly perfused kidney.